And an incompetent administration is like its own natural disaster. When you've got a president who engages in magical thinking and says, no, he decided there were only 15 cases and they would all be gone by April. And whatever it is he decides, my gosh, it almost doesn't matter what he decides. The point is, he's not listening to the scientists. He's not listening to the experts.
An incompetent administration is like its own natural disaster. That warning from Senator Elizabeth Warren turned out to be more than just a bumper sticker worthy summation of what we're now living through. When you consider the timing of when she said that, it was also pretty prophetic. Senator Warren said that in an interview on this show on March 5th. Which was 6 days before the WHO declared a global pandemic. It was 8 days before the White House declared a national emergency. Since delivering that fairly prescient breakdown of what was coming, Senator Warren has published a sweeping plan for how the country ought to respond to this crisis, from what to do about the threat to human health to how we should try to save the economy. Back with us now is Senator Elizabeth Warren. Senator, thank you very much for sticking with us again. I appreciate you being here tonight.
Glad to. I'm glad to be with you.
So you knocked me for a loop a little bit when I interviewed you back in the first week in March, and you laid out what you saw coming, particularly in terms of the forthcoming economic collapse. At that point, we were looking at a market collapse, but not an economic collapse. Now, of course, we've seen the economy disintegrate. Of all the ways that we haven't done what we should have done as a country, what stands out to you the most? What do you think has been our biggest failure so far?
So let's start on the health front, because everything follows from that. Not getting our arms around the magnitude of the coming healthcare crisis early on has been what's led to every other problem we've got. And that starts with two really essential pieces. The first one is the personal protective equipment for our first line responders, for the doctors and the nurses and the ambulance drivers, because they need to be protected. When they're not protected, they get sick, and that just compounds the strain on the healthcare system. The fact that we didn't have a stockpile of masks and of gowns ready to go, of respirators ready to go in January, when we could see this problem coming our way, just speaks to how poor the leadership was from Washington. So that's the first part of it. The second part on the health front is not to have the tests, because without the tests, you're flying blind at every point. You know, I can't tell you how many people I've talked to, either themselves were sick or they had family members who were sick in different parts of the country, in Oklahoma and California, who said, yep, doctor said that could be coronavirus. In fact, it probably is, but we have no tests. When you have no tests, you can't track what's happening and where it's going. We need now then to focus on both of those. Getting the equipment needed for everyone. This business of having states bidding against each other and then having the federal government come in and seize it. And it appears in some cases turn around and let someone else sell it. This makes no sense at all. And it's putting people's lives at risk. So we need to take care of making sure the equipment is available, that we're protecting people, that we have enough of it. But the second part on the tests, we got to ramp up, I mean, really heavy on the tests. The notion that we're still talking about testing in terms of tens of thousands instead of tens of millions means we're just not on top of this. Because understand this about testing. If you're only testing people who have symptoms, or you're only testing people who make it to the hospital, then you're not understanding what's happening everywhere in the country. And for something like a viral outbreak, you've got to be ahead of it. You've got to approach it when it's still small, and you've got a chance of dealing with it. You were talking about the problem in South Dakota. You know, as the governor just lets this problem get bigger and bigger and bigger and wants to think that she can pretend it out of existence. That's just not going to happen. So that's the first part, and that's where the biggest mistakes have been, and these are the mistakes that are costing people their lives and then ultimately costs us our economy as well.